Hello, this is Dr. David Green, CEO of the Mid-Atlantic Pain Network. Today's topic is an overview of medial branch blocks. Back and neck pain is rampant in the U.S. It affects 90% of Americans at some point in time. Back pain is the second most common reason people go to the doctor, just behind the common cold. It's the leading cause of disability in those under the age of 45. Up to 40% of those who undergo back surgery are unsuccessful, and the cost of back and neck pain in the U.S. exceeds $100 billion a year. Now, at every level of the spine, from the neck all the way down to the sacrum, you have facet joints. And these are, on the left and the right, they're about the size of a thumbnail, okay? And these are the cause of back pain about 45% of the time. The disc in the front is the cause about 40% of the time, and then there's other causes for the rest, like the SI joints down low, okay? These facet joints do have cartilage, just like any other joint, the hip or the knee, and they are prone to arthritis. Even though they're small, the size of a thumbnail, they can be a tremendous source of back pain or neck pain. So diagnosing the source of pain can be a little bit difficult. You have a history and a physical, and then when you look at x-rays and a CAT scan, here's a CAT scan for instance, you have these beautiful looking facet joints here, nice and smooth, nice joint space, but then this looks kind of ratty. The interesting thing is that this person may have no pain, and this person may have tremendous pain. So it doesn't always match up with what you see. The medial branches are the little nerve endings that come and feed sensation to these joints. Okay, so they come from above and they come from below. This is a nerve root coming out from the spine here and here. That's not what we're talking about, okay? We're talking about these little branches that come off of those. Now, a medial branch block is done for two reasons. One is diagnostic, to see if in fact that joint is the source of a person's pain, and two is therapeutic. In and of itself, it can provide excellent pain relief for months. Modern pain doctors do use image guidance, either ultrasound or fluoroscopy. Once they get into the vicinity of the facet joint, they inject numbing medicine and possibly some steroid at two areas. One is above because you have the nerve endings coming down, and then down low you have the nerve endings coming up, okay? This is an outpatient procedure. It takes under 20 minutes. There's really no sedation necessary for either the neck or the back for a medial branch block. Now, it does help pain doctors figure out if the joint is the source of the pain. If the injection works well, then you can sit there and say that joint is arthritic and that's causing the person some symptoms. If the injections work well and then wear off, you can either repeat it or you can go onto a radiofrequency ablation, which is where a catheter is put in and heats up and deadens these medial branches, and that can provide pain relief for anywhere from 18 to 24 months. So the average pain relief for medial branch block has been shown to be 3 months. So even though it's diagnostic, it's also therapeutic for quite a while. It works well in 85% of patients, and repeat procedures work just as well as the original. So you don't have to go on to a radiofrequency ablation. You can keep doing medial branch blocks every few months. Now, this is a picture of radiofrequency ablation as we just mentioned. The catheter is put into the same area, heats up and deadens those nerve endings from above and then from down below, and there's no motor function to these nerves, so deadening them for a while is not a problem. It's a good thing if the joint is arthritic and the sensation is dulled. And that, on average, provides 15 months of pain relief, but studies show anywhere from 6 to 24 months. The top non-operative pain management in the Mid-Atlantic region is through the Mid-Atlantic Pain Network. There are many clinics throughout the area in the network. Over 50 insurances are accepted. Over 25 treatment options are provided with the board-certified doctors. Visit us online at midatlanticpainnetwork.com and then call us at 855-444-6585 for scheduling. I'm Dr. David Green with the Mid-Atlantic Pain Network. Your pain stops here.